Hi guys, welcome to another episode of Hangout with Busayo. Okay, today we are going to be talking about something special. So we have someone special with us, and we have with us a doctor. Let me just allow her to introduce herself. A doctor, you have the floor.
My name is Bernice Ayo-Ajayi, and I'm a medical doctor.
Yes, today we'll be talking about this thing that has affected the world, shut down economy, sporting activities, shut down almost everything. Guys don't go to school. Even in Nigeria here, we have had that universities have been shut down, polytechnics, all higher institutions, even primary schools, and all has been shut down because of this particular virus, which is called the COVID-19. And we have a doctor here with us to discuss it with us and also give us, enlighten us about this virus and know how we protect ourselves and also our loved ones from being infected by this virus. So let us allow Dr. Bernice do justice to it. So, Doctor, what do you have to say concerning COVID-19?
Okay, COVID-19 means coronavirus disease 19 for 2019, which is the year it was discovered. So the coronaviruses are a large family of viruses that have been known to cause infections in humans and animals. Of global note are the SARS-CoV-1 virus that caused an epidemic in China, and then there was MERS in 2012. So the current virus that is causing COVID-19 is SARS-CoV-2, SARS coronavirus 2. Okay, so it was also discovered in China in 2019, December precisely, in the city of Wuhan. So the disease it causes, coronavirus disease 19, is what we've known as COVID-19, that has spread all over different countries in the world, causing deaths here and there, and has been declared a pandemic by the World Health Organization.
Now, I don't know. I didn't know that we have a SARS-CoV-1, SARS-CoV-2, and you see, that's why we need to have a doctor to really enlighten us on this.
Yeah.
Okay, now, how does this virus spread, and what organ in the body does it affect?
Okay, so the coronavirus affects the respiratory system,
Wow.
from your nose to your lungs and everything in between. So typically it causes respiratory symptoms: cough, sneezing, congestion that you see as catarrh, difficulty breathing, and they cause fevers. So every other thing you can experience with a fever: headache, body weakness, joint pain, and all whatnot. SARS-CoV-2, causing coronavirus disease in particular, tends to cause dry cough. You may or may not have sputum, may produce sputum or not. So people can experience mild symptoms. They can also experience severe symptoms.
Okay, so it affects the lungs. So is
Yes.
there now? I just want to take an instance. Now we're not trying to scare anybody. After one is healed or from that virus, does it have any after effects? Maybe there's a possibility that something is a little bit damaged in the body, or it
Yes.
heals completely.
About that, this is a novel coronavirus. This is the first time we are seeing it affecting humans. So the long-term complications have not been fully established, although there are propositions that it may cause a chronic pneumonia. That means repeatedly, someone that has been affected may keep coming down with bouts of pneumonia and might even need hospitalization some of those times. But this is the first time we are seeing it affecting humans, so none of that is proven yet.
Oh, okay. So how do we protect ourselves from this virus? Because right now, everywhere you go to, even if someone, for instance, now in a cold region of Nigeria, like Plateau State, where everywhere is cold and you have the rains, and one starts sneezing, people just start running away from. Upon any sneeze, you see people cutting out in folds, in 100 folds, running away because someone is sneezing. How do we prevent ourselves from getting those things?
Okay. I'm going to try to slow down a little so that I don't miss anything that is important out. First of all, this is a global epidemic, a pandemic. It's affecting different countries in the world. The World Health Organization keeps uploading information about it in the simplest possible languages that people can understand, that anybody can understand, and not just healthcare workers. So it's important to keep our ears open for the correct facts. Don't get your facts from just anywhere, because everybody seems to have become an expert now. So people are preaching garlic and onions and drink hot water and and all whatnot. It's important to keep our ears open to get our facts from the correct places. The WHO, the Center for Disease Control, that's NCDC in Nigeria, and maybe if you like, the CDCs of other countries that have it, tougher. you give the more appropriate information than just getting information from WhatsApp or Instagram or any of all those places. And then we've been told to wash your hands. Wash your hands. Wash your hands. Soap and water is our friend in this period. It's the simplest hygienic strategy ever. Applies for everything else. It's the easiest way to prevent diarrhea, especially in children. Just wash your hands. You know, when you step out of your house, you're coming back, you wash your hands. You shake people, I don't know. Before you touch food, you wash your hands. You use the toilet, even if it's just to pee, you wash your hands. Like, we could use hand sanitizers, but they are not as effective as washing your hands with soap and water. You said something about people running
when sneezing.
Very nice strategy. Yes. Anybody coughs or sneezes around you, phew, run. I mean, and if you must cough or sneeze, please do the dab. No. Yep. Much more effective is use a disposable tissue and throw it in the trash immediately. But if you can't do that, then cough or sneeze into your elbow. Do the dab and cough or sneeze. Physical distancing.
Oh.
Okay, don't worry. It's particularly important for staying around people that are either coughing or sneezing. Give at least 1 meter between you and them. You know, just guide. You want to sneeze, just like even if he's sneezing into his elbow, still
move back.
Yes. So the virus has been noticed to spread in crowds, understandably, because people cough and sneeze anyhow without paying attention to the hygienic rules. So stay away from crowds, if as much as possible, because of how much it's spreading. Don't move around in this period. Fortunately, our country, like most other countries, have now asked that we should, we've restricted a lot of gatherings. They've shut down schools and shut down non-essential businesses and services. So we should only go out for the essentials, really. We know that we don't have the capacity that some of these countries that are calling for help now have. So we don't want to let ourselves get to where they got to, before they started calling for help and all whatnot. These countries have, so to say, functioning health systems. They have a much higher doctor to patient ratio than we do and all of that, and they are still overwhelmed. Our default state was overwhelmed. So we don't want to get there. Just stick with whatever guidelines are being provided. If they say you should stay at home, please do stay at home. Equip yourself with the necessaries and stay at home for the good of yourself and your loved ones and your neighbor. If you get infected as a young person, chances are you would likely survive the disease. But apart from the fact that we don't know the long-term complications yet, you might infect your neighbor. I'm not planning to get infected at all, because I'm not living with my parents, but I work with elderly persons. I live around elderly persons. I live around children. So I'm thinking about them. I don't want to put them in trouble as well. And if you're a young person, you're not currently staying at home, I would advise that you shouldn't be in a hurry to run back home, because, I don't know, your parents may have comorbidities. They might have heart disease or diabetes or something that places them at higher risk of dying from this disease. So please do them the favor and stay where you are. Also, if you think you have reason to be worried about being infected already, for example, you came in recently from France or the US or something,
Italy,
please be kind to humanity and isolate yourself for 14 days. We are begging you.
They are begging you.
All of us are begging you. But think of it, your family is also humanity, and all that. So isolate yourself. If you develop symptoms and they exceed mild, you call the NCDC toll-free number. 0800097000010, I think, something like that. Okay, so please call the NCDC toll-free number.
Okay, and now let's thank you. We've done these things now. I want us to now switch things. I don't know if you know how to speak pidgin. No, like you look like someone
Sabina.
You sabi speak
but
pidgin.
Speaking.
Okay, we'll do this thing for pidgin now. We'll do it in pidgin. Let's just help people, at least to spread this around, to help people. We'll just give them what to do. We're going to wash their hands using soap and water, and also if they want to sneeze or cough, you have to dab and other things that we mentioned that could help safeguard ourselves from this. So we'll do it in pidgin.
Okay. You don't too. Okay, try. Okay. Bros, madam, abeg, wash your hands. Now that one, they very important part. Important thing. Okay. Like say you no do anything else, just make sure you wash it. Just they wash and they go. You know, get hand sanitizer, you just they wash your hands and go. You want call for a one sneeze, abeg, it down. Thank you. You see person where they do anyhow for your side, you take cover.
Take cover, maybe you cut that.
Yeah, so you take cover. No joking this time. They know they work in and not be this time you won't carry leg, go your sister house, go they gossip COVID-19. Abeg, dey your house.
Now they your lane.
Yeah, dey your lane.
At least before everything go clear. Coast go clear.
Unless you won't buy food, you go find water, I be won't buy gas. Nothing. We're supposed to carry you come up for your house again. Unless you be doctor, nurse, pharmacist, lab scientist, or you dey sell food. You no be any of these people, abeg, dey your house.
And media people like us too, we no suppose dey house now. Now they give people information.
No be essential services.
Okay, thank you very much, Dr. Bernice, for joining me on the show. I hope you enjoy yourself. I hope you got one or two things from what we discussed today. And before then, let's just go and check out our comments from last week. Yes, we had our program on the topic last week was on commitment, but COVID-19 is here. We need to be committed to our hygiene too. Yes, very important. So we'll just go through some one or two comments there on our YouTube. So, okay, let me just take this one from Abigail Additional. She says, this is really amazing. Well done, guys. Don't forget we spoke about this commitment. And this one is from Adisa Muyuluwa. It says, grand, enjoyed every aspect of it. Very realistic and true. Kudos to the guests, Anchor and the crew. Yeah, kudos to our one and only Influence Films. And this one says from Bello Olado. He said, I enjoyed every piece you guys discussed and I have learned as well. This is the second time I'll be watching this. Great work, guys. Greetings to the guy behind the camera. Wow, greetings to him. And the last one is saying, Frankie, with so much brilliancy, dog my card. Great job, guys. Thank you very much for your comments. We really appreciate it. And don't forget, I will be back again next time. And Doctor, just give us your BYE to them. Let's tell them that we are going. They should not. Doctor, we need to keep 1 minute. There's 1 minute that they say. How will we get to will I use tape pro and tape pro ourselves?
Don't worry. We're not coughing. We're not sneezing.
Yeah. So
we just do the high five.
Okay, the high. Don't touch.
Alright. So a final word. Please spread faith, not fear.
Yeah.
Spread caution, not panic. We can do this. We really can.
We can.
China did a good job and they've set an example for us that we can actually, push this thing back. If the virus doesn't move on its own feet, we carry it. So let's try not to carry it further. Yeah. Thank you.
And I will say, bye.